I'm very excited about having the Friendship Center here of Emmet County. Our area agencies on aging, and we have one in Charlevoix County as well, are exceptional resources. Most people do not realize the types of services that our Friendship Center offers or our Charlevoix County Commission on Aging. So I'm very honored to have Jodi Mundy here. She is going to share some wonderful things about the resources that we have if you wish to stay in your home and you're looking for activities or you need home care services. Just tickled pink to have Jodi here to explain all of that for you. So, Jodi?
Hello, everyone. Okay, so I am the social worker at the Friendship Center of Emmet County and going to give you a little review of what we all guess. Could you talk a little closer to the mic? Sure. There. Does that matter? Yes. Good. Everyone can hear me? Yeah. Okay. So show you some resources and services that we offer for Emmet County seniors. Okay, so we are a nonprofit. We are designated as the local council on aging. This is for senior citizens age 60 and above in Emmet County. That is who we offer our services to. We've been serving Emmet County since 1967. We recently expanded our building that is up on Anderson Road. We added 1,000 square feet to our dining room because we are outgrowing our space. We're going to have to figure out what we're going to do with parking because some of our lunches that are big ones, we've ran out of parking space for everybody. So, which is an amazing problem to have. The purpose is we want to enhance the quality of life for older adults. We want to help you stay in your home for as long as you can and as long as it is safe for you to do so. And we want you to be able to do that with independence and dignity. So some of our core services are our in-home and supportive services. We offer personal care. We offer homemaker services, which is a light housekeeping type service for senior citizens that can't do those things on their own. When you have our services, if you have one of our members come into your home and they're doing laundry and cleaning your house and running to the grocery store and picking up your groceries for you and bringing them back. We do what we can within reason to keep you in your home as long as you can, as long as it is safe. We do offer Meals on Wheels, and then we also offer congregate meals Monday through Friday. That's one of our big draw-ins that kind of gets people into our building, and then they become more involved from there. We do have transportation. I'm sure you've seen our buses out on the roads. They are going constantly. Health and wellness. We have a blood pressure clinic. We have foot care appointments. Other health and wellness, we do a lot of like cooking healthy for one presentations, all kinds of things. Kayla, she's at the back of the room, who does our outreach type marketing stuff, partners with Manna and other places to get us fresh food boxes. She's written a grant for fresh vegetables and fruits along with Bill's Farm Market to provide those to seniors. Enrichment, education, and social activities. Let's see, we do cardio drumming, we do yoga, tapping, line dancing, tai chi, all kinds of things. Information and referral, a lot of that goes to myself, but also our wonderful receptionist. You call her, you have a question, 9 times out of 10, she's going to be able to walk you through that. If not, she's going to say, hold on a minute, I'll get Jodi, and then we'll have a discussion. And then we also have our volunteer program, which is completely in-house now. So the homemaking, the personal care, we offer respite care. We have a medical equipment loan closet. Things are donated to us. You do not have to check them out. You do not have to pay for them. The shed is around the back of our building. Come in, borrow what you need, and we just ask that you return it if you can when you're finished with it. We do have PERS units, the type that hang around your neck. Another thing Kayla has done is she wrote a grant for us we purchased 20, Kayla, right? 20 PERS units that now work off of GPS. So you can go out into the community with them now. The ones we had prior to this were strictly only worked at home within a certain, as long as you were close to the base. Nutrition services, here's our Meals on Wheels. Suggested donation of $3 per meal, where it costs us almost $13 per meal to prepare per meal for each person. And we have just a suggested donation, 60 or above in Emmet County. If your family comes in and your granddaughter wants to come and have lunch with you and she's not 60, that's absolutely fine. She just purchases a guest pass for $5 and she gets to enjoy lunch with you. Same with our congregate meals. Transportation, you've seen our buses. It's $2.50 per ride. And it's within all of Emmet County. We go all the way up to Mackinac. We go way out by Goodhart. We stay within all over Emmet County. Health and wellness. We have exercise and fitness classes. This is a picture of cardio drumming, which is one of our biggest draws at the Friendship Center. We have health screenings and clinics, foot care clinics, and we also have many support groups. On the back table, we have brochures that show all of our supportive services that we have. Yes, you had a question.
Your buses, do they run 7 days a week, 5 days a week?
Monday through Friday.
Do they have regular routes, or are they scheduled based on who calls and needs to go where?
So within the city, it's easier within city limits. It's easier for them to kind of maneuver. Someone calls and says, oh, I need to get to Meyer. Devin, our transportation head, will try to accommodate that. But for routes up by Mackinac and out by Brutus and things like that, they are scheduled. There are specific days. Enrichment, education, and social activities. We have games and recreation. There are always seniors and staff members at the puzzle table throughout the day. You could walk in and see a staff member and a senior playing cribbage in the lobby. You could walk in and find some people playing whatever game this is, dominoes of some sort, and come in and join them. Or we have a library that is just come in and borrow a book and bring it back. No need to check it out. It's on a trust basis, and that works out great. We have all kinds of special events that go on. Kayla just told me we're working with Pond Hill Farm to have a tour done out there. We did just go to Bear Creek Organic Farm and did a tour there. And a big thing for us in our building is connection. We try to connect seniors with one another. I can give you an example of that. I run the grief and loss support group up at the Friendship Center, and we had a lady that came in and sat for months and didn't say a word. She just sat with us, listened to others, whole lot of tears. She finally came in, spoke with me privately, told me her story. Next week, the following week at grief group, she opened up a little bit more. And then the following week, a little bit more. Long story short, her and another widow in the group now do so many things together throughout the week. They go to lunch, they come play bingo, and then they've recently, within the last 2 weeks, both have signed up to become volunteers for our program. So those are the connections that are really important to us. The social work services, this is Jill. This is not Jody. This is Jill. So with the social work services, I do individual support. You have questions about yourself, about home, about your family, about your kids, things of that. I also do families come in and talk to me about what's this going to look like moving ahead. How should we plan this? Where should we go? What should we do? I'm a very big advocate for senior citizens. If you are struggling with something and you can't quite figure out where to go, what to do, give me a call and I can hopefully help walk you through that. If I can't walk you through that, I will work to find someone that can. Resource navigation. And then our Senior Essential Needs Fund. I'm also in charge of that. We have a fund set aside at the Friendship Center from donations strictly that are for essential needs. If we were talking about Medicare earlier, some medications aren't covered. Every year it changes. An example I can give you is a gentleman came in and his heart medication that used to be covered is no longer covered. So while he's trying to figure out during open enrollment what he's going to do, how is this going to look? I can't afford this. I'm going to go 2 months without my heart medication. What do I do? We were able to pay for those 2 months of his heart medication out of this Essential Needs Fund. Last week, we had a senior citizen call. She is in tears. She lives strictly off of her Social Security and her refrigerator broke. I have $100 left at the end of the month after I buy groceries and pay bills. And how am I supposed to buy a refrigerator? We were able to do that for her. Our volunteer program, this is Mark and Ronnie, two amazing volunteers. You come into the Friendship Center, let them know you'd like to join our volunteer program, fill out paperwork, and then Christy and Mary Margaret that run that program, they will call you and ask you, hey, today we're handing out fresh fruits and vegetables. Would you be willing to come in and bag those up for a few hours and hand them out? Or August 21st is our Senior Expo up at the Friendship Center. Huge day. We need lots of volunteers for that. So we call and, hey, are you available? And lots of opportunities. Also, those opportunities are out in the community as well. We have recently partnered with Petoskey Schools, and we have our volunteers running their concession stands during games. The seniors love it because they get to watch the game while they're doing it. And then also Petoskey Schools is able to get in there and make some money off of concessions. Why local services matter? Local services understand local needs. A faster, more personalized response. We like to build trust with familiar faces. We love to have people come in. Someone came in earlier and said, "You look so familiar." Oh, in the back row there. She's like, "You look so familiar to me." And I was like, "Friendship Center?" And she's like, "Yep, that's where I've seen you." Reducing barriers. We keep a very up-to-date resource guide at the Friendship Center, a booklet. We can also email that in digital form if anyone needs that. Just call the Friendship Center, let us know. Protects vulnerable populations from being overlooked. In my department, I do a lot of that. That's a lot of the advocacy I do. An example of that is we had a Meals on Wheels driver drop off a meal to a senior in our county, and she's very upset and does not know how to handle a situation. Our driver said, "Well, what's going on? Maybe I can help you." Long story short, her landlord was not being very kind to her. So our Meals on Wheels driver comes back, reports that to me. I make a phone call, and then all the wheels start turning and going, and the advocacy is happening. And we were able to help calm that situation for her. And then a big thing for us is we like to preserve, like I've said multiple times, your independence and dignity. We believe senior citizens should be able to stay in their homes as long as they can, as long as it is safe, and do it with dignity. Caregiver and family support, like I said, we've the PERS, the information and referral. We offer respite care and support groups. How to access our services? You have to be 60 or above and live in Emmet County. Eligibility requirements. If you're looking for in-home services, we come out and we do an assessment. It's not based off of finances. It's not based off of anything like that. We come out, either myself or a nurse comes out, does an assessment, and just make sure that you qualify need-wise for the services. I would also like to mention that all of our services are by donation. No one is ever turned away from a meal because they can't eat. Meals on Wheels does not stop coming to your house because did I say can't eat? You can't pay. Meals on Wheels does not stop coming to your house because you can't donate. Any of our programs, you can attend all of them. If you can't donate, that's fine. Come on in and still come see us. So we have our main location, which is on Anderson Road in Petoskey. And then we also have a satellite location in Brutus for more of our seniors up in that area as well, that it is difficult for them to come into Petoskey. Community partners. We collaborate with healthcare, public health, law enforcement, emergency response, and advocacy. I wish I could remember their names, but I can't. They came and did a presentation right before David Moffett went missing, probably a year before that. And they explained to us how they use that watch and those tools. It's comparable to the boxes that are in aircrafts that send off the GPS satellite so that they can locate them. Same thing with this watch. Same thing. Unfortunately, David was scheduled to be fitted for his watch the day after he went missing.
No.
So, of course, our agency, along with many other people within this community and outside of this community, were involved in the search looking for him. And I don't know if you're up to date on it or not, but he is still missing, which is traumatic. So after this experience, our executive director, Deneen, who could not be here today, she started digging into why don't we have some kind of system like we do Amber Alerts when children go missing? Why don't we have that for the vulnerable population of senior citizens? So Deneen started the Silver Alert Initiative, and it has passed every step that it has needed to pass so far. This next one is a big one because this is where it has just died before. So we are crossing our fingers and calling legislators. We are sending out information. We are doing everything we can to get this passed. If you look up on our Facebook page, I'm not sure if it's on our website, it may be, but there will be information of the legislators that you can call, leave a message, send a letter to, whatever, talking about why this Silver Alert Initiative is so important. Had we had the Silver Alert, David's outcome could have been very different, even without this watch. It could have been very different. There was a gentleman that saw him walking, that knew him, saw him walking and thought he was just out walking his dog that day. So many things could have been different for him and his family. Success stories. We have a Veterans Coffee and Donut Hour. It is a nice get together for communicating with other veterans who share commonalities. After I lost my life, it has become my lifeline. That is big. A lot of our seniors that come in, yes, we still have married couples that come in, but a lot of them are single and alone and in isolation. I can't tell you how many times I have heard weekends are the hardest for me because you guys are closed. We become their people. The people in the Friendship Center become their people. Here's a picture of our revenue. You can see that the senior millage is the biggest part of our funding. And then if you look at client contributions, 5%, our state and federal funding, I'm not even going to go into what's happening with that. Yes. Our special events and fundraisers, very, very, very tiny. We do one big fundraiser a year, and that is coming up in October. It's a lot of fun. It's a great time, but it's just the one big fundraiser that we do. If you have questions about that, call up to the Friendship Center and ask them about our big fundraiser in October. To get involved, if you want to get involved, you can join us at our centers. You can volunteer. You can come in and do a presentation if you would like. If you're from a different area agency, you can advertise in our Silver Threads, which is our monthly newsletter that is sent out, or advertise on our buses. Become an advocate, of course. You can donate or sponsor something. Just give us a call and we can help you walk through any of that stuff. And there's our contact information. Does anyone have any questions for me? I know it was quick. I'm a fast talker. I'm sorry. Yes.
Is the Silver Alert going to be statewide?
Yes.
Instead of just come? Okay.
Yes. It will be statewide. So that would have been alerts went out on the cell phone.
Only old states have it?
Yeah. Kayla and I did a presentation a couple weeks ago at the Inland Waterway Rotary by Kayla. And I read off some facts about the Silver Alert there. States that have it, I wish I could remember the specific states, but I can't. But one of them is in the 90th, like 90% of Silver Alerts, those seniors are recovered safely. Another state is 70-some%. Here's the crazy, insane thing about Silver Alert. Utah built their Silver Alert program off of their existing Amber Alert program for just over $4,000. Why aren't we doing this? Why isn't this important? Why hasn't this been pushed through? And we can do the same thing. We can build it off of the Amber Alert system. And it's something that we need to look into. It's something that needs to happen. Seniors are a vulnerable population. Seniors with cognitive struggles like dementia, like David, so vulnerable. We need to get this passed. And yes, it will be statewide. It'll go out over TVs, over your cell phones, just like an Amber Alert does. Yeah.
The health clinics that you mentioned, are those ones that you have to make appointments for in advance, or how do they work?
It kind of depends. We have hearing aid cleaning clinic that we make appointments for, and then we also have hearing check clinics that we make appointments for. Those are done by Adam Long. And then the blood pressure clinics, you do not need to make an appointment for. You just pop in, and wait in line and get your blood pressure done. We offer the flu vaccine clinics, COVID vaccine clinic, all of those things will start coming up as well. Any other questions? Yes.
Charlevoix County, do they offer the same services?
I don't know.
I can answer that question. Sorry. Charlevoix County does have very similar programming, not the same, but very similar. So if you're from Charlevoix County, get a hold of the area agency. It's actually the Commission on Aging. They also have 5 senior center locations. So East Jordan, Boyne City, Charlevoix, Beaver Island. They're very active as well. We're just really fortunate to have wonderful Commission on Aging area agency on aging. So jump on the phone or get on the internet and look them up, and they'll give you all the information.
Thank you. Yes.
So I understand focus is for Emmet County residents to stay in their homes as long as possible.
Yes.
For those who are residents, say, of a senior center or like Indigo, Independenceville, right? Is there interaction with any of the residents at Independence Village?
Come up to the senior center?
Initial
Oh, absolutely. Yeah, absolutely. We have a lot of seniors that come from Independence Village that'll come up, from other apartment complexes that come up and enjoy like our activities incorporated with the things that Independence Village does as well. Absolutely. Yep. Yes,
I understand they're not open on the weekends.
we are not.
And what are your hours Monday through Friday?
Monday through Friday, we are open 8:30 to 4. Any other questions? No? Okay. Thank you.
Okay. Is that helpful? Is that good? Okay, good. If you have questions or you want to have a private conversation, put it on your door prize entry form, and they'll give you a call.